Don't do that. Oh, he does it again on the other side. Oh my gosh. I've always said it a million times. Do not pull an impaled object out because you can cause more damage. Now, he's in the middle of the wilderness and he may have to do that. You want to actually get to help to get the bleeding to stop. That way you can salvage the rest of the limb. Oh, he's on fire. He's patting it out, which is fantastic. If the blister is not opened, it's protecting, it's sterile. It's when those wounds open up, you want to use an ointment.
You want to borrow my ointment?
Keep the wound clean. People think to dry it out, you actually want to keep it moisturized. Oh, nice, perfect. He was able to use a type of dressing. It could be a dressing that's impregnated with like an antimicrobial type substance, or it could just be to protect the area so you don't get schmutz and dirt into the area. Oh, no! The way that it's hanging there, it's definitely double boned. That means the radius as well as the ulna are fractured. He resets it, which we actually do in the emergency department. But typically after you reset it, you need to put a splint on it because it's still floppy. It's not attached anymore. Oh, nice. The way that it's sounding and crunching is probably broken. Once the joint is out of place, all the muscles spasm and keep it held in that bad position. So if you can actually get the muscles to relax, you can pop it in pretty easily. Oh, ow, no. How do you get a nail in between your tissue here? Depending on where it is, it's probably fine. It's probably going in between your metacarpals and it's just a soft tissue injury. But you always worry about tetanus, so you have to make sure your tetanus shot is up to date. Oh, rebar to the abdomen. Again,
Pull out game weak.
if you hit the intestine, you pull that out, now you have flying out in the abdomen, you become septic. And if it goes untreated for too long, you're gonna die. Oh! Snake bite, you have to get Crofab if you get bit by one of these snakes to counteract its effects. There are multiple different venomous snakes out there. Just know which ones in the area that you live to be aware of. Oh, nice. Just using like good bandage. You always have to worry putting on a bandage. You want to make sure it's not too tight because you can actually decrease blood supply. Your hand turns purple, white, blue, and tingly and numb. If that occurs, take that off and rewrap it. What is that? Oh my gosh. There's only a few instances where you actually go after the bullet and take it out. Most of the time you just leave it in. The risk of causing damage to the tissue is greater than in that moment of potential poisoning. Oh man, maybe the bullet's causing pain. If it is that superficial, you can take the bullet out. You're using dirty things to get it out, so you have to worry about wound infection. Bullet wounds themselves, because they're so high pressure and so much heat, most likely not going to cause an infection. Falling. Oh my gosh. Here he's got a floppy wrist, potentially fractured the distal ulna, distal radius. If it goes into the joint, you always run the risk of having chronic arthritis, so really need to be careful. Oh my gosh, you have to worry about the different microbes that are actually in the ocean water. At least get it cleaned out and then watch it. And then if you start seeing erythema or redness to the wound starting to creep up, get to the hospital. You probably need certain different types of antibiotics. Oh! Wow! The hand itself is so vascularized. There's a lot of special nerves in there. It can cause a lot of damage. You just have to be really careful because once you injure these type of distal nerves, you're probably not going to get them back because they're so small and you can't really fix them. They're just tiny little strings. Oh, he is just so shot up that he's just taking out all the bullets that he can get. Nice. Bullets don't just hit the tissue and typically stop. Usually they go through the tissue and cause damage on the routes that they take. A lot of times we see bullets that just go through and through. Nice. When in doubt, throw a good wound dressing on there. Sometimes we use a dressing like this that might be impregnated with an antibiotic ointment, so to speak. Oh no! Will that hurt like a son of a? Yes. Can you actually do that? Yeah, you can. In the hospital, we do something similar. We have a Bowie knife. It heats up so it can actually cauterize small blood vessels. All right. Oh, you know what gets me with these is the sound. It doesn't make that kind of noise. Is he using his own teeth to pull that out? Oh my gosh. Every time he fixes himself, he's like, you don't want to move it. It's going to hurt like hell. Uh-oh. Driving a truck or an SUV. Oh, he's popping pills. It could be related to ibuprofen, could be antibiotics, could be pain medications. Oh yes, the famous good duct tape. You can use duct tape for anything. It covers wounds, you can take out splinters with it. You can even treat plantar warts because it takes a little bit of the skin off every time. So you put it on, take it off, put it on, take it off. What happened? Oh man, oh. That is gnarly. Are you gonna bleed out and die from your hand? Probably not. In this situation, probably just fine to pull it out, but you definitely need to do a pressure dressing to that area. The cigar is probably just hanging out in his mouth because he's walking around holding his pistol with 2 hands. You're giving up your position by having smoke around you, but at least you're able to use it to then cauterize your wound. Oh, nice. In a lot of these depictions, you don't have the amount of swelling that you would have, even instantaneously. It's good that he's actually relocating them quickly because the more swelling that you actually end up having, it's harder to get it back in the joint. Oh, the fingers. I have seen so many x-rays where the fingers like almost like 90 degrees. Very easy to put back in, almost like you want to like pop your own joint. Does it hurt? Yes, of course, but it feels so much better once it's back in. That's pretty cool. So I wonder if he's using the duct tape as a way to defend himself against the wolves there. And maybe this way it protects you a little bit against the bite. Obviously, teeth can penetrate through that, but maybe it gives yourself a little bit more time to defend yourself. Walking through a swampy area back in Vietnam and stuff like that, they always ran the risk of having something called trench foot, where their socks and their boots were always wet. You always increase the risk of gangrene, wound infections, things that won't heal because you have tissue breakdown. Oh man, rusty metal. I bet this guy's had so many vaccinations. Probably gets a tetanus shot every year. Oh, straight through. If you hit into the bone, one, is going to be harder to get out. And then you really worry about something called osteomyelitis, which is an infection of the bone. If somebody gets that, typically it's 6 to 8 weeks of antibiotics. Think about that. Whoa, 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 whoa. What am I looking at already? Gunshot wound right to the heart, right to the thoracic cavity. We can actually do a thoracotomy where we crack open somebody's chest to get all the blood clots out of the way, find the problem, and then close it. We got blood splattering kind of randomly. Typically, with these type of injuries, you could have blood squirting out. But if there's this much of an injury, this injury typically doesn't make it to the emergency department. Oh, we're going for an arm. Oh my gosh. If somebody has their arm amputated off like that, basically you need to get bleeding under control. Direct pressure, bulky gauze. If that can't stop the bleeding because it's a major blood vessel, your last resort is a tourniquet. The game having this audio in there, it's kind of disturbing. I actually hear these true sounds of an individual in the emergency department. It hits at your heartstrings. Very difficult situation to work in. A lot of times when we have these events, we actually have decompression meetings afterwards so we can actually talk about what's going on because we're human beings. You don't want to bottle it up and cause more problems inside. But then did they bandage it up? Not sure what that character is doing, but it looks like there's a bandage that's put on and the bleeding has stopped. Now at this point, pick up the limb, get to a hospital ASAP. Okay, stay away. This actually looks like a table saw. We see a lot of saw injuries that come to the emergency department. Skill saw, table saw, freehand saws, lots of different types of saws out there. We see a lot of lacerations and amputations. Oh, when somebody gets a saw injury, a lot of times we'll end up getting an x-ray of somebody who has a laceration just to make sure it doesn't go into the bone, because if it goes into the bone, you get concerned because there's an increased risk of getting osteomyelitis. A lot of times people will come in to the emergency department. The bandage is either soaked with blood or it's wrapped. We'll actually take it off.
You gotta rip that band-aid off now. You'll thank me later.
Remove the clot, clean it with a lot of water, high pressure type of water, and actually anesthetize the area. And that way, at least while somebody's waiting for the imaging or waiting for the doctor to get ready to sew it up, you can at least be anesthetized and not feel the pain anymore. Oh my gosh, a knife wound. We get knife wounds a lot in the emergency departments. Maybe go just underneath the skin, could go maybe a centimeter. The concern with those is knowing exactly how far deep they actually go. So you don't typically just do blind probing with, say, a Q-tip if you're not a surgeon, because you can cause more issues. Very small puncture wounds, do you close them up or not? If, say, somebody is bitten by a dog, you typically do not close those up because you have an infection that might be seeded deep into the tissues. Versus a puncture wound by a blade, it's up to the discretion of the doctor, depending on the cosmetic repair as well as location. Okay, so the axilla, aka the armpits, you have major blood vessels that run through there. Obviously your neck, you have your carotids and your jugulars, and then you do have lots of superficial blood vessels everywhere. Even though it might not be a major vessel, it's still going to bleed, and the first thing you do is compression to that area. Put pressure on the wound to get it to stop bleeding. Who creates games like this? It's not like a game, you're just shooting things. Shotgun injury, we don't see those very often in the emergency department because usually they're quite detrimental. People typically don't survive. I have seen people come in with shotgun pellets still in their tissues, in their bodies, very hard to get out. You can cause a lot of damage to try to actually get those out. And then you always worry about future lead poisoning. A lot of times you can get what's called dry drowning and wet drowning. Is there water in the lungs causing a blockage of transmission? Or do you have spasming within the airway itself that blocks the ability to get air in and out? We actually see individuals that are attacked for no reason.
No reason.
We get people that come to the emergency department for every different scenario possible out there. Our job is not to really know about the story. Our job is to treat the problem that we see. We'll have individuals such as U.S. Marshals and Border Patrol and detectives and police officers. They provide some information, but they're actually there for a separate job as well. They're waiting for the patient to be medically cleared. Baseball bat injuries, it's a piece of wood or metal, fracture of a bone. You worry about something called rhabdomyolysis, and can cause renal failure, aka kidney failure. Other things you think about, hyperkalemia, so when a cell breaks down, the potassium is inside the cell, and if you have too much potassium that's circulating, it can actually cause cardiac arrhythmias and actually kill you. It's just a little disturbing to just watch because I see this in real life. Broken jaws, collapsed foreheads, broken eye sockets, eyes that are just coming out, teeth that are missing, all because somebody just used this type of baseball bat or object onto somebody's face. Here we go. Oh my gosh. When you see blood go into water, the blood seems like a ton. But if you take one drop of blood and you put it in a gallon of water, the whole thing's gonna get bright red. We see this a lot when people come to the emergency department. They show us a picture of the toilet because they're having maybe, say, rectal bleeding, and the whole toilet is full of blood. And it's like, well, it looks scarier than it is. We say, you know, after you have a laceration and we sew it up, don't soak it. Don't go into a bath. You can clean it off, shower, but don't soak it because it potentially can keep the wound open and it doesn't allow it to heal as well as it should. Lower extremity injuries, these are quite common. Vascular injuries we worry about. Other things are something called compartment syndrome. You can have an injury and then the injury causes a significant amount of swelling. The tissue basically cannot thrive anymore because there's no more oxygen, and then the tissue can potentially die. Relating to compartment syndrome, the pressures are too high, talk to an orthopedic surgeon and emergently do what's called a fasciotomy, which is basically the fascia that overlines all the muscles is this silvery white material that you actually cut to allow the tissue to swell more to get the blood flowing again. Typically, we don't see many explosive injuries. That is more military medicine versus civilian medicine. We do see injuries and events that are similar to it, car accidents, fires that could have some, maybe a propane tank explosion, those sorts of things. You worry about not just the injuries, but the burns. All I can think about when I see this is when you have a lot of different injuries like this, you have multiple people, you have to basically triage who's going to immediately die, who has the most life-threatening injuries right away, who could wait a little bit, different things, so you can actually help the most amount of people with the resources that you have.
The most amount of good for the most amount of people.
Okay, wait a minute. Before we even start, he's riding a motorcycle. This game would be so cool if he actually put on a helmet. Because obviously you need to have a helmet in case you fall. Of the people that I see get into accidents and have bad things happen, it's because they're not wearing a helmet. You can get really bad road rash, snap a bone. I've even seen people come in with their limbs missing. Please wear a helmet if you're actually riding a motorcycle. And trying to do weird tricks with kicking it. Oh, man. Duh. Literally that type of injury is going to take off your head. If you do survive, EMS will get there. They'll put you in a seat collar. If your helmet's there, they'll actually still keep the helmet on and stabilize your neck with tape and maybe some pillows to try to pull off the face shield as well as the helmet all at once. Oh, geez. 2 people. Wheelie. Oh, get off the train! Oh, wow. The guy gets run over by a train. He literally gets cut in half. Is that survivable? Yes, you've heard of weird stories where somebody survives, but very much unlikely. If it's your abdomen, you're cut right through the abdominal aorta. Your blood's just gonna pool right out of your body super fast, and you're gonna die pretty quickly. We're yachting, and we're trying to land on the yacht. Oh, the blood that's smearing on the nice white yacht. You're having multiple abrasions and you're getting your skin just kind of ripped off because the yacht has the coatings. When you fall on a gymnasium floor and it's got that coat of like lacquer on it, same idea where you like skin it off. You get some sort of head injury that can cause you to pass out. You smash your head, your brain goes forward and backwards. So you can have a coup, counter coup injuries, and you can bruise both ends. You can rip the bridging veins of the brain itself, which then can lead to a subdural hematoma. You can also get a subarachnoid bleed, and you can get skull fractures. So these are the things you worry about when somebody hits their head. Nice.
Here for the magic touch.
Whoa. The amount of people that I've seen that have been hit by cars, man, people get destroyed. Sometimes we even see people who come in who are still alive, but their skull is busted open and you actually see brain matter, and some of the brain matter is actually coming off. On the bike. Oh! You would not be alive if a car comes smashing down on your unprotected head. Super close range like that, blood splattering everywhere, and I'm assuming that a lot of the tissue would be gone from such a close range.
There won't be a trial unless you're...
Oh! Immediate stop, head injury. The big thing you worry about is drowning in this instance, because now you're unconscious, you don't have a life preserver or a life vest on. And if you're in a dead man's float position, your head's in the water, you won't be able to breathe. So hopefully somebody there to get you out ASAP. And then you also worry about cervical spine injuries, but you do your best to save their life and protect their neck, but you're also trying to keep them from drowning. Ouch. You know, you fall off that ledge, hit a rail, you can actually fracture a bone pretty easily. You get concerned that you're gonna break a rib, and if you break a rib, then you're concerned that you might puncture a lung. But then, how the heck do you avoid a falling helicopter where the blades are now just cutting you in half? That's like the worst outcome.
This is the one thing we didn't want to happen.
I gotta call my dad. Poor bag.
Oh my gosh! Texas Chainsaw Massacre is the first thing I'm thinking of. It's ripping through the left side. The left side has your spleen, your kidney on the back. You can actually live without your spleen, but if your spleen gets injured, a lot of bleeding. You can live without one kidney. Very interesting what we have one of and what we have two of. What is this thing? It almost looks like one of those wind turbines that we see that are supposed to generate energy. I've seen people in smaller versions of like a meat grinder where they've gotten their hands stuck and they've come in degloved. Or the hand totally removed. If you don't have the hand to replace it, it's just an amputation at that point and close up the end of the wound. You just slid your face against the wooden ground that probably just caused a lot of splinters to go in your face. If you ever get any splinters, you can try to take them out with a tweezer. Some other easy, fun home remedies would be like using duct tape, trying to get it stuck to the duct tape and pulling it out. Elmer's glue, put it on there and then just peel it off. What? Took a shot right to the right flank, through the spleen maybe, or just above it, and it could have went directly into the heart. Sometimes we see where one shot actually kills an individual or causes a significant amount of damage, versus other times if you have lots of wounds and lots of through and through injuries, sometimes they actually miss everything and you're okay.
No why? Now give me that.
Oh.
What's up, home? I tell the best stories ever.
Oh my gosh, what? Man, that is scary. The guy's got a machete on them.
Machete.
It just took massive slices. We see a lot of people get slice like that on the back. Luckily the ribs are protecting, so it goes through all the muscle and the skin, all the subcutaneous fat there, which we can sew up. If you start getting deeper into the abdomen, if it goes through, a lot of times you'll actually have to have exploratory laparotomies where they actually go in and explore and see if anything has been cut open. Oh, what is this? Taser? Oh, he's got a taser.
My God!
Oh! We see a lot of people come to the emergency department with taser injuries.
Don't tase me, bro!
Or just to have the taser barbs removed. Typically when it ends up happening, a police officer would use the taser and they cut the wires off, but they're just these probes just sticking there in the skin and they have a barb on them. So if you try to pull it out, it obviously gets stuck in the skin. So we'll use an 11 blade to try to cut the skin off of where the barb is catching. Oh! Wow. Somebody getting hit, lower back.
My back!
You definitely worry about fracture. Down in the lower spine area, you worry about whiplash, you worry about cervical fractures, and then the trauma to the face. Typically, if somebody came into the emergency department with that injury, you get a head to toe CT scan and a full evaluation. A lot of times people actually will come to the emergency department with these type of injuries and actually refuse all care and they'll just leave. Come on!
Come on!
Definitely happens. We see people who get hit by hammers all the time, either by accident when they're actually on the job site or on purpose. The people are using hammers as a weapon to hurt other individuals. Getting hit with a blunt object, you're not getting hit with the backside of it, which actually has the prongs. That's typical hammer. Oh.
Jesus.
Chainsaw injuries. Literally, I've seen people take a chainsaw and pull it up to cut, and they've cut their own head. I've seen it bounce and hit people in the thighs or their leg, even onto their back, even hitting somebody else by accident, all on the job site. So you got to be really careful when it comes to using a chainsaw.
We're gonna fight that?
What the heck? Get him! Oh! Take out the kneecap, right above the kneecap actually. Your kneecap is also called your patella. Lacerating right above there might be separating all the quadriceps muscles. So if you actually do that, you won't be able to flex those muscles. And if you can't actually have those operate, then walking is going to be quite difficult. Oh! Right down the backside of the forearm, you're cutting through all those extensor muscles. Extensors meaning muscles that extend the wrist.
It's all in the wrist.
Versus the flexor muscles are on the forearm side or the inside. So you won't be able to actually lift your arm back. And that's actually really important for tennis players who get pains up on the outer aspect of your elbow, and it's actually called tennis elbow. Oh! What is this power move? All the lacerations and injuries. If you did come to the emergency department and you had all those lacerations, the biggest things we worry about are the major blood vessels that are super deep. Your veins and your arteries typically run together, but the veins are more superficial, so those will actually get hit first typically, which will then kind of just ooze out versus spurting blood out. Oh, right to the face. Oh, a little concussion, hitting the jaw. You see people who get into fights and they get knocked out with one good bell ringing hit. But it just depends on where you get hit, how it affects your brain to knock you down, lose consciousness, or get dazed. Oh. Ow! The biggest thing we worry about in trauma when somebody gets hit on the side of the head is an epidural hematoma, which is typically caused by a middle meningeal artery injury, which is on the inside of the skull. Those could be catastrophic and cause something called a lucid interval, where you might get knocked out, you feel okay, you go to sleep, and then you don't wake up. That's why we always want somebody to be evaluated when they actually do get a severe head injury. Oh! Holy cow. So this guy is that strong to do probably a cervical fracture, cervical dislocation. That's crazy. So what you're actually trying to do is separate the functions of your brain from your body. Typically, you're trying to disrupt your brainstem. Brainstem having to do with your autonomic nervous system, relating to your heart beating and your respiratory drive. This guy is jacked.
You're going to have to kill me for that to happen.
Oh, jeez.
I warned you.
His punches don't even hurt him. The size of his hand compared to this other guy's hand is like nothing. You know, we see people who get hit in the ribs, the abdomen. Non-medically, individuals call it like the solar plexus. We don't call it that. We call it the epigastric region. When that gets hit, you can lose your wind and have trouble breathing. And then if you get hit in the ribs, you always worry about fracturing a rib or just bruising your ribs. Every time you take a deep breath, your ribs are moving, it hurts.
Finally.
Getting hit in the face, you run the risk of fracturing your jaw. A lot of times when you get a jaw fracture, you fracture on one side and actually fractures on the other because of the amount of force that it takes. It cracks here and cracks here, so it like explodes out.
Fine.
He's got a nice laceration to the right cheek, very common. Right in that area, we see injuries of the infraorbital wall. I always tell patients if there's a fracture that communicates between your sinus and the orbit itself, not to sneeze. Because if you sneeze, the air that goes into your sinus actually will shoot out into the soft tissue of your face and cause all this like significant nasty swelling. And it hurts.
My turn.
Oh, that guy is bad. Holy cow, he just mustered up some sort of strength. They are flying around this world. If an individual falls greater than 3 times a normal individual's height, then we consider that a major trauma, and we are concerned with multiple systems that could be injured, fractures, dislocations, hematomas, contusions, ruptured organs, anything disastrous lying underneath the skin, the tissue, and underneath the bones.
Okay.
Pain stops real simple.
Oh my gosh. He's trying to choke him out. If he would have held it longer, he might be able to make him lose consciousness, or what we call have a syncopal episode, basically decreasing blood flow to the brain or inhibiting some oxygen to his body. But typically it has to do with more strangulation on the side than actually preventing somebody from breathing. If you're holding down the major blood vessels, then you're compressing everything, no blood in, out, decrease oxygen to the brain, decrease blood flow, you're gonna pass out. Oh my gosh. With all that trauma and punching somebody's face and you're hitting their mouth, you're gonna hit their teeth and cause lacerations to your hands, which then increases your risk of getting infections because the human mouth is so disgusting and dirty. If you came to the emergency department after punching somebody in the face and you hurt your hand and you have lacerations, we would potentially give you antibiotics because of the concern of an open wound with a bacteria from another human's mouth. Oh man! If a tree actually fell on top of you and pinned you down,
does it make a sound?
There are different circumstances that it could actually kill you. It can crush your skull. It can also pin your chest down, cause hemothorax, pneumothorax, basically injuries to your chest. And then it can pin you there for days on end. Oh! Well, he's strong enough to just pick up a tree and wield it like a sword. I feel like a normal human would have some vertebral fractures, specifically like the spinous processes of the vertebrae. Could cause some paralyzation if there's like a jagged component to the rock and you get bent over that spot, especially with that amount of force. But again, these guys are just bad and things don't hurt them. Oh man, so definitely would have like cervical fractures, you're having flexion injuries, and then skull fracture with the underlying bleeding of the brain or contusion of the brain. Typically, you call 911. We very much will always ask if you're having numbness, tingling anywhere, can you move all your extremities? And then you'll be placed in a seat collar. Everybody on the planet hates a seat collar. We have specific criteria of why we actually put somebody in one of these, and it's just to keep your neck still. Oh my gosh. I can't imagine anything worse when you're in a fight to then being bashed the back of your head into rocks that are actually crumbling because you're getting hit so hard. Somebody's head would just literally crack open like an egg if there was that much force.
They're behind me too. There. Hold on. Go.
Oh. Just run over somebody. If that occurs, we think about it as a major trauma and you're worried about fractures, internal organs that have been just demolished. If you get run over, you're worried about crush injuries.
She went under the wheels.
Oh, damn. Was not wearing seatbelt, got tossed to the other side. There's a lot of damages that can occur. We get people who get brain bleeds, skull fractures, missing limbs. It's been proven that seatbelts save lives and people still don't use them. So please wear your seatbelt. Those wires, depending on the amps, there's a high chance of tissue destruction, muscle breakdown. It can cause your heart to stop. Hopefully somebody gets there quickly on scene that can then use energy again to then try to restart your heart. Oh, no. Oh man, people getting infected with a fungus. There are a lot of different fungal infections out there, but we're limited by how we can treat them. It is a big burden worldwide, but we have a few antifungal medications out there that may help.
Get out of here before this fungus beats us alive.
Sweet, a health kit. I'm not sure what's in this health kit, but if you have one at your house, you should have like basic stuff. Band-aids, gauze, maybe some antibiotic ointment or steroid ointment. Medications wise, acetaminophen, ibuprofen, and probably diphenhydramine, which is Benadryl. All right, crouch it down, put the health kit on. There we go. We got wrapping the forearm. Really cool integration of healing techniques in a video game. You actually have to take time out of what you're doing to then use it. Actually really good because it's more realistic. Oh! What is happening? You can cause somebody to pass out pretty easily by decreasing blood flow to the brain real fast, compressing down on the carotid arteries. Just be aware, even if you're fooling around with your friends, please don't hold any of these type of chokeholds. Oh! I think about the blood being splattered all around. Is it infectious or not? We think about this in the hospital where somebody has a bloodborne pathogen. He's wearing a mask, so there's some sort of aerosolization of this. Same thing with the hospital. We're wearing different types of devices to prevent any droplets of infection getting into us. Barehanded, you're punching somebody in the face. It's actually a really bad idea. You're gonna potentially fracture your own hand. Boxer's fractures is typically a fracture of your 4th or 5th metacarpal. It snaps and angulates really badly. You'll be in a cast for a while, and sometimes you might need a pin if there's too much angulation. Sometimes you see in these games where somebody gets shot once and they die. That happens. Sometimes people can get shot 10 times and they still survive. It just all depends on where they get shot. And literally this is something that we do see at the hospital. Oh! With these type of injuries, you have typically a small hole and then a big hole on an exit wound. So a lot of times we'll see broken skull in the back with some brain matter coming out. Brain matter is typically like a grayish white in color. Kind of soft actually, it's softer than you think.
Don't do anything stupid.
Oh, man. What are you thinking? Like shooting somebody that close to you? You just perforate your eardrums. You have a ringing in your ears all the time. That's called tinnitus. It also causes distortion of balance because the balance center of your brain has to do with your vestibular nerve in your ear. A lot of fist fighting. Oh, this is intense.
Intense.
Hitting their face on the rail, you're going to cause potential fracture or laceration. You're also concerned about whiplash injury, where there's a cervical spine injury where the body's going down and the head kind of snaps back.
Look, all right, just hear me out on this. I got it.
Oh!
Stop!
You see the guy, he took a foot to the nose and he's got a laceration to the bridge of the nose there. This is your nasal bone right here, this top piece. You can fracture pretty easy. I've had people come in where it's like literally to the side and you have to snap it back over if it's really deformed. He's got his arm in a funky position. He's probably doing some rotational forces to it. And if you continue to rotate, it's just gonna cause a lot of discomfort on the shoulder itself. And it can cause a rotator cuff injury as well as potentially dislocate if you have enough force in a different direction.
Excuse me.
I didn't have much of a choice. I owed someone. Just give me a couple.
Oh! I want to know, did he just break the elbow? Holding down the force on the humerus, does he pull up on the radius and the ulna and snap it back and either fracture or dislocate? A lot of times you would think that you'd snap off the olecranon. Typically that hurts a lot.
That's gotta hurt.
Oh! With using that type of either polymer or metal, you're gonna cause probably some potential fractures. I don't know if anybody's hit this bone here in the back, your mastoid. It hurts a lot. Underneath that is a styloid process. It can cause a lot of pain too. It's actually one of those pressure point areas to cause pain. Is it raining? All I can think about is trench foot that you could potentially get soggy, wet, typically your feet where they don't heal, and then it's called like wet gangrene. Basically you can get where like the tissue starts to rot. Oh! Always have to make sure that you get dry clothes on. You can also cause a lot of chafing in certain areas and cause chronic wounds. We see that in the emergency department when somebody comes in with rotting tissue. It smells so bad, but if you use sodium bicarb, it actually neutralizes the smell so everybody can tolerate it.
What's ETA?
Couple minutes.
Oh, wow! A blade right to the lateral aspect of the leg above the knee. Mostly muscle there, not any major blood vessels are sitting right there on the side. They're on the back side of that. Now it can cause a lot of pain, and then if you sever the tendon and the muscles, obviously the leg's not gonna work as well as it should. When somebody first passes away, they're gonna be potentially just dead weight. They're actually really, really heavy. Then over time, rigor mortis is gonna set in and it's gonna be stiffening of the body because you have pooling of fluids that make tissue really tense and really hard to move.
Marlene set us up.
Marlene.
Why the hell are we smuggling an infected girl?
I'm not infected.
No?
Look at this.
I don't care how you got infected.
We see people who come into the emergency department who are actually bit by another human, and you can see bite marks like that. We definitely give antibiotics, we clean it out as best we can, and we actually leave the wounds open because if we seal it shut with sutures, it's actually going to seal the infection inside the wound. Oh! Very rarely is something stuck in the skull. Obviously, if you're hitting in the temple area, it's a little bit thinner bone, but on the top and the back, it's pretty thick.
Pretty thick.
And then you're actually seeing the anatomy, which is actually really good. You can see how deep set the eye socket is. The nose actually has a bone at the top, and you see the teeth, the mandible. This is fantastic, really cool. Yep, and then we get the ribs. Oh, exposure of the spine in the back. You actually see these two wings. These are the scapula. The scapula is attached to your arm. You have your humerus that comes up and the clavicle comes on top. When somebody actually fractures the scapula, we have a high suspicion of a lot of other injuries that occur because the amount of force that it takes to actually break that bone. Oh! Holy cow, so the ribs just explode. They don't happen like that. We see rib fractures all the time. When you actually have a rib fracture, it kills. It hurts so bad. The same pain is seen when you actually don't have a rib fracture. Say you have a dislocated rib or a bruised rib or a pulled muscle in between. You can't just like splint it and prevent it from moving. You have to breathe, so it has to expand. So no matter what, you're causing pain every time you take a deep breath. Oh, what? Typically, if somebody's gonna be smacked to the ground like that, the ribs are probably going to break in potentially one of two places, either on the side anterior or in the back. They're kind of like a C shape, almost like a wishbone. They can snap pretty easy at any point. Oh man, I don't understand how she's getting back up. Ribs fractured on the backside and the vertebral column just popped. Okay. The anatomy is really good. You're seeing the spinous processes, you're seeing the transverse processes, you're seeing a lot of different structures of the vertebrae itself, which is pretty impressive. Oh, I fractured my own back. I know what that feels like. I had a transverse process fracture. Didn't even know it was fractured. Felt like a pulled muscle. I had to wear a corset that had 2 metal rods in the back to keep my body structured. You're really worried about injury to the spinal cord and anything below that area. You may have paralyzation. You might get tingling. You might get pain. It all depends on where on the spinal cord it's irritating you. Oh man, skull on skull, fracture to the posterior aspect, we call that the occiput. Sometimes you can have a skull fracture, a little bit of bleeding around the brain, and you know, it's treatable. Actually, because the skull is fractured and open, it allows the brain to swell a little bit, and so there's not a lot of pressure pushing on, but you also increase the risk of infection. Obviously, you need to be admitted to the hospital, and it's gonna be a long stay. Oh, somebody comes in with a nice cervical fracture like that. We're gonna put a C-collar, a rigid, hard C-collar on. Everybody hates them. If it's really bad, you get something called a halo, where it's actually a device that's screwed into your skull, typically at 4 points, so literally it's attached to protect your spine. Oh! Blade right through the face. We see a lot of people who get injuries to the maxillary sinus, and yes, it could go all the way through. On the opposite side, you're having pieces of the brain back there. We do see people who get puncture wounds where the blade's already out or whatever it is there that caused the injury. You have to be careful of like sneezing, blowing your nose, because you can actually blow air into the tissue and it hurts like hell. Wow. Intra-abdominal, all the way through the spine. Outside of the bones, we think about the aorta, we think about the inferior vena cava. These are your 2 main blood vessels. If you lacerate one of those, you potentially just get a bleed out into the abdomen and you could potentially die. Whoa. You see how the nose potentially goes right in the face, the whole structure here? That's actually called a Lefort fracture. There's a couple different levels of Lefort fractures depending on where they're fractured and how much connectivity there is or lack of. You're gonna need to fix that with probably some plates to be able to get the structure back intact. Oh, wow. I've seen a lot of jaw fractures. The jaw is called the mandible. Usually what happens is if it fractures in one area, it fractures in another area. Treatment for that is having your jaw wired shut, almost like having braces on, but you get a really cool set of pliers in case you feel like you're nauseous, you want to vomit, so you can actually pop the wires off. Not fun. Not a cool injury.
It's not cool.
Typically wired shut for 6 to 8 weeks. Oh. Oh, a high cervical fracture. Those are like super dangerous, super bad. We're seeing the head just snap to the side. You have your C1, C2, C3. Once you start getting fractures at that area, the mortality is pretty high. We actually think about it as almost like a rhyme. C4 and 5 keeps your diaphragm alive. So if you actually knock that out, then you're actually not going to be able to breathe. So you actually have to be on basically a ventilator. Rip through the solar plexus. That area is the epigastric area. I don't know what organ he's pulling out. Could it be the heart that he grabbed and ripped out? Maybe. Could be the spleen, could be the stomach, could be the liver, could be the pancreas. These are all kind of organs in that area. What? The bones of the eye socket are actually pretty fragile, especially in the back, and your brain's on the opposite side. So if there's enough force and something sharp enough through the eye, you can go straight back into the brain. Typically, there will be some blood, just depends on the major vessels that are hit or not. I don't know if any of you have ever seen the Bodies exhibit. They show an exhibition where it's all blood vessels, and you see a high concentration over like your major organs, your brain, the heart. Super cool. You know, even just Google it online. It's very impressive. You can actually fracture somebody's face by kicking them pretty hard in the heel. The heel is a very dense bone. It's actually called your calcaneus. We see a lot of back fractures that are occurring from falls from great heights. You know, anytime we see anybody fall from 3 times their own height, it is a major trauma. Oh! Super cool to see the x-ray of somebody getting hit in the ribs. The ribs there are basically to protect your spleen, to protect your liver, obviously the vital organs of your chest, your lungs, and your heart. Very cool to be able to see that. crazy end. Oh, Devora just gets smashed right in the ribcage. It almost like inverts. Some people actually have chest cavities on the inside. It's called pectus excavatum. And then people could also have something called pigeon chest, where the chest actually goes the opposite direction and goes out. When somebody gets hit in the chest like that, I'm super worried about blunt trauma to the heart itself. The heart's a muscle and actually could bleed, cause bruising. A lot of times we really worry about the lungs bruising, because if the lung bruises, that area that actually is bruised can't oxygenate tissue. Oh! Whoa! Whoa! Wait a minute. We're doing blunt trauma to the lumbar spine, getting that amount of trauma to your back.
My back.
People always say, oh, you got your kidneys in the back, like kidney punches. And then obviously you're going to have destruction of the bones of the lower ribs, as well as the spine, breaking off potential of the spinous processes. And then obviously you have the top of your pelvis and you have your iliac crest that can actually fracture from blunt trauma like this. Oh no! Chainsaw injury, it looks like to the right flank. Obviously, I don't see that type of injury specifically, but we do see chainsaw injuries. Typically, it rips, catches, bounces all around. I've seen people who have hit themselves in the head, hit themselves on the arms and on the legs. You'll see basically destruction of the skin all the way down to the muscle tissues. Trying to repair that is actually pretty difficult. Oh! Good defense in the sense of using your hand against the blade. A lot of people would just turn away, but using your hand, obviously it hurts like heck. Our hands are so sensitive. There's so many nerve endings. That's why we can actually like touch and feel things and know what's happening. Okay, we're always vulnerable in the neck because of the jugular vein and the carotid artery. If those are lacerated and you're not able to compress them down, you will lose a significant amount of blood. And if you lose 40 to 50% of your blood volume, roughly 5 to 6 pints of blood, you're gonna die. Oh! That almost looked like a machete.
Machete.
Kind of mid, soft area. Good graphics in the sense that the individual didn't die right away, obviously a couple seconds later. But the spleen is protected underneath the ribs. Mostly where you're gonna get is intestine. The descending colon occurs on that side, as well as the sigmoid colon. You could have some small intestines, and then your collecting system, meaning your kidney in the back and the ureter coming down. Oh, what is that? When I am at the hospital and I need to get a major central IV line, we're doing major blood infusions, you go to the neck or you actually go to the groin. Even here, your brachial artery is accessible. Typically, we go to the neck. Look at that neck! Because it's a cleaner area. So it does make sense in these games and in the shows that the bad people end up going to the neck. Oh! We actually have in medicine ECT, the type of therapy where you use energy to shock the system, so to speak, and reset the neural pathways. There's not much side effects to it. You can cause some amnesia.
Where am I?
Typically it returns. You'd use this in people who are bipolar, severely depressed, even schizophrenia. And it's been studied for a very, very long time. And there actually has been good data out there that shows that it has a lot of benefits. Obviously, if you're using too much energy for a too long period of time, then you're going to fry the brain.
Fries your brain like an egg.
Or cause more long-term damage. Oh! Obviously, it takes a lot of strength to wield a big axe. Then you have a lot of weight behind that blunt object that has a little bit of sharpness to it. So you can cause a lot of damage in the sense of a blunt trauma with some lacerations and possible fracturing of bones. If you get hit in the head, you're going to have the initial trauma injuries to the face, but you could actually get intracranial bleeding, subdural hematomas, epidural hematomas, and subarachnoid bleeding. Freddy Krueger. Look at that glove. Oh! Big knives right through the back into the thorax. Probably pretty rusty. Definitely hitting the heart, lung, aorta. Big major traumas. Obviously, you have to be super strong to be able to do that with just your arm. This injury, I don't see in the emergency department. We'll see sometimes puncture wounds from different types of trauma. Unfortunately, it does happen. People do stab each other. We do full head-to-toe assessment, put tubes in where we need to.
Tubes.
And repair any place that needs to be repaired. What? Come on.
Come on!
Stop clowning around. We definitely see people who lose their digits. Typically, you can't attach these fingers back. Sometimes you can. If you can find the finger, one, stop the bleeding, wrap it up. Don't put directly on ice. Put ice in a bag of water or something like that. Make it like a water bath. Then wrap the finger in, say, a gauze, and then put that in the ice bag. Oh, forearm puncture. Oh, Achilles tendon. Wow. Forearm puncture wound, not too bad. It's going to be mostly soft tissue injury. Down to the ankle, Achilles tendon ruptures. You won't be able to push off because you basically have just decreased the attachment of your gastrocnemius as well as your soleus and won't be able to run away or walk. And then just destruction to the abdomen. We've actually will do an abdominal exploration surgery where they may need to do from the xiphoid, which is the bottom of the sternum, all the way down to the pubic bone to open somebody up in the case of an emergency. Oh, this is classic for the Scream mask. That's messed up. Getting hit in the back, you always worry about puncturing the lung, puncturing the heart on the posterior aspect. If you puncture the lung, it might collapse. So we actually put a tube on the side called a thoracostomy. If the heart is punctured, it could actually bleed within the mediastinum, which is in your chest cavity here, and cause a compression of the heart itself from all the blood that's leaking out. Oh, nasty. Oh, that's a Stranger Things looking guy.
The Demogorgon!
That's just mayhem and destruction. Surviving somebody who just eats your own head. Not something totally seen in the emergency department, but very cool. I'm a fan of Stranger Things. What? Oh, injection. Cool.
Cool.
One of the weapons is injecting some sort of nasty, maybe infection, parasite, microorganism that's moving fast in the body. In history, for real, people have tried to use different poisons. We see it in the news. Most of the time, there are different types of nerve agents that people are using. Sometimes there's ricin. There's a subspecialty within emergency medicine called toxicology. They study this all the time. Oh, this just creeps me out. That just creeps me out. Not cool.
Not cool.
Fractures of bones. You'd be surprised. There's a lot of blood that actually runs through the marrow. So when somebody fractures a bone, it actually bleeds a lot and swells a lot. It makes it difficult to reset. So if you actually have a bad injury, get to the hospital ASAP so we can actually reset it faster. The more it swells, the harder it is to get back in place. Ooh, Hellraiser. Oh my. Almost look like a modern day Iron Maiden device. Spikes and you're put in it and it impales your body. Obviously, all of that is going to cause bleeding. The bigger traumas are going to occur when you actually take them out. I always say don't pull things out when it comes to trauma, injuries, impaled objects. It depends how deep it is, what they've actually injured. If it injures a major blood vessel into an organ, you take that out, it's going to just bleed profusely. Oh, I gotta comment on the anatomy. You're seeing all the ribs, you're seeing muscle. It almost looks like there's no skin or the person's so dehydrated that you're able to see everything through that. Why is this doctor shirtless and almost looks possessed and sick himself? I would never go into a hospital shirtless. Like, come on.
Come on!
Oh! The elevator shaft crushed that thing in the mid-abdomen, kind of lower chest area. What actually happens with that? Rib fractures, obviously, if the area is low enough, so you can snap some ribs, and if the ribs snap, it causes a lot of pain. And unfortunately, when people fracture ribs, there's really not much that we can do at the hospital. They kind of need to heal on their own, unless they're so destroyed. Then there's an evaluation by an orthopedic surgeon. What? Holy cow. Holy cow. Just impaled right through the abdomen, still alive and moving, which is actually more realistic because you're not going to die right away. If it's just punctured through the intestines, it's just going to slowly bleed, especially since you haven't removed the impaled object and increasing your risk of infection. You could probably be there for at least a couple days. Holy cow. This looks like the old device that they would use in like medieval times, but using almost like a hatchet slash axe onto the anterior chest wall, which again, causing some lacerations, blunt trauma to the chest. You can cause pulmonary contusions or lung bruises. When you have a bruise to your lung, it actually decreases the ability to oxygenate blood flowing through because there's not a normal exchange of gas to the blood. Then obviously you can have a lung collapse and then multiple rib fractures. Whoa! Is that like a pickaxe? Oh! Wow! I didn't see that coming.
I did not see that coming!
Large, long spear, left side of the chest, could hit the heart, could just go straight through the lung. The heart is a central structure. It changes position as we breathe, as our diaphragm is moving up and down. If you're in that moment of an exhale, get that type of piercing wound, then there's a chance that you can potentially hit that left ventricle, which is like where the money is. That's the money shot, basically. What? Come on.
Come on!
This isn't a video game? So you're lacerating your neck all the way across. Please, nobody do this. Carotid arteries and jugular vein are on either side of the neck here, underneath the major muscles. Midline is your trachea and your esophagus. The blood's gonna pool out, not squirt out with every heartbeat. Oh, fall from 1 story up, but it was probably about the height of 10 to 20 feet or so. Unless you land directly on your neck, you're gonna have some blunt trauma, but it shouldn't cause major issues, even though anybody falling from that height, we do treat as major trauma because there is the possibility of a lot of injuries, but immediate death, you unfortunately just have to land in that perfect spot.
Little pig.
Whoa. Versus that kind of fall, which seems a lot higher and probably killed us as a player. What was up with that guy's teeth? He almost looks like a scary clown. These growths on his back, or is it just massive trapezius muscles? The trapezius muscles are those lumps here on the neck where like some of the weightlifters that we see out there just like jacked. You know, like, where's the neck at? It's because the trapezius muscles are so well developed. Computer. Oh, a syringe. What are they doing there? That needle looked really long. Everybody freaks out with a long needle, but it's actually the wider the diameter, that actually is more scary. It has to do with more discomfort and because of the wideness. Sometimes we'll do needle aspirations of like an abscess in a tonsil, and it's easier to use a long spinal needle. That way we're not sticking a huge syringe in somebody's mouth. Same with when we do a lumbar punctures, aka spinal taps. So
I didn't want to have to do this.
So check out that syringe. It's got the thumb holes and finger holes. That is more commonly used at the dental office or oral surgeon's office because of the ability to hold it in one hand. We typically do not use these in the emergency departments. This one you would re-sterilize versus we have all disposable tools in the emergency department. I've used this every now and then. It does make life a lot easier, but you can get done 99% of everything I need to get done in the emergency department with a normal syringe, normal plunger versus one like this.
There is so much yet for you to witness.
Whoa, creeper.
Where'd you get those peoples?
Obviously, if he wants him to witness more, it's probably a sedative of some sort. In the emergency department, we do use sedatives for multiple different reasons. For conscious sedation, aka sedatives, or even anxiolytics, so anti-anxieties, or for people who need to calm down. Versus here, probably using something quite off-label. Fire! Whoa, exploded fire. Fire running past, you gotta be really careful. Sometimes you can cover yourself with a blanket or a fire blanket or something like that, but you're always worried about breathing in the fumes and the flames, so you can burn your own airway. So you have to be really careful. House fires, there's potential for a lot of cyanide due to different plastics that are around, and then obviously any superficial burns to tissue. Oh!
You paying attention?
Wow. I'm assuming he cut off of a finger. Remember, if you lose a digit, grab that thing, wrap it in like a wet gauze, put the wet gauze maybe in a bag with the finger in it with ice, maybe ice water. You don't want it to get freezer burn, but you want to cool it down. You want to stop the bleeding on your own finger, get to the hospital ASAP. And then he smacks him in the face. Actually quite good from a gaming standpoint. He cut his finger off, and we as the gamer got like blurry, lightheaded, had this like weird feeling, which happens. You get lightheaded, you get dizzy, you feel like you're gonna pass out. The medical term for passing out is syncope. This would be described as a near syncopal episode where you're almost about to pass out because you're in so much pain. So it's quite common.
It's a lot for you to absorb.
He's cutting all his fingers off? Oh, he did! Holy cow.
I don't believe that man's ever been to medical school.
So he's missing his index finger on the right and he's missing his ring finger on the left. And actually, it looks like the index finger on the right, you can actually see the bone. So sometimes when you have an amputation, by whatever means, the bone actually is sticking out further than the tissue. How are you gonna close that up, right? So you actually have to use something called a ronger, where you basically are cutting the bone back down, so that way you have tissue to cover over top of that area, especially if you can't reattach it. Oh, almost looks like the humerus. The bone is actually in sharp edges, and that's kind of actually what happens in real life. When the bone fractures, it's not typically a perfect snap. It actually goes in different angles. A lot of times people will have a bone that is displaced, and we have to actually put it back in anatomical alignment. Sometimes we have to be careful not to slice our own fingers. Wow. In through the mouth, right to the front part of the brain. Frontal part of your brain, personality. You typically will see people who get meningiomas or tumors of the brain in the front. Things start to change. They're not showing like outward signs of my arm doesn't work, I'm having weakness or numbness. They're actually having a little bit of personality changes, and that's kind of like one of the early signs. And then late signs are headaches, nausea, vomiting, people passing out. People say, okay, hey, the temple or the side of the head is the softest part. There's no real soft part. You touch your head, it's hard. But could the bone be a little bit thinner in those areas? Yes. So could it have the easier potential for a blade to go through? Yes. But very rarely do we see puncture wounds and injuries going that direction. Most of the time, it's like front and back.
Front and back!
These type of injuries don't come to the emergency department. There's no head, not something I'm going to be dealing with. Then people always ask, oh my gosh, how long does the body live for? You're gonna still have some twitching, some moving, but just for a few seconds. Could there be a little bit longer twitch or a non-specific movement thereafter? Yes, but it's not purposeful. Was that just a saw? We've seen a lot of chainsaw injuries that come to the emergency department. I've seen people getting just a simple laceration to their tissue, maybe hit an artery, maybe hit a vein, close it up, to chopping off fingers, hitting the bone, hitting your own head by accident. I've seen people's hair get caught. In that circumstance, the arm is gone. That is when you would use a tourniquet. Oh my gosh. Tears the person from the clavicle over. The clavicle, most people probably know, it breaks pretty easy. If you fall on your shoulder, it could snap really easy. You can also dislocate it in that area. If your scapula has a fracture, your first rib, or your sternum, you have to have a high index of suspicion that there's even something worse going on underneath, because those bones take so much force to actually break. Oh, there it is. You see the vertebral bodies going up, and then again, you're seeing other organs on the inside. Have I ever seen this come into the emergency department? No. Slicing the brain in half and the spine and all that connective tissue. If you get deep enough into the thoracic cavity, you're gonna hit the heart, you're gonna hit the aorta, and you bleed out and die anyway. We see a lot of blunt trauma to the side of the head, and we always worry about the middle meningeal artery. That can cause an epidural hematoma, and you can have a phase basically where you're like, I'm fine, and then you're not fine, and you can herniate and die. So puncture wound to the eye, you actually see brain matter and maybe skull fragments going flying backwards. It's actually kind of more realistic. If you get so much trauma to your eye, you can't really replace your eye. Hopefully we can soon. Oh, they just love those humerus injuries.
You get people who've got a right funny bone.
Different type of humeral fractures. Proximal, it kind of stinks, but it'll heal pretty well. Mid-shaft we worry about because the nerves and the blood vessels kind of cross underneath in that area. And then distally relating to the elbow and a joint. If the joint is involved, then you have a higher chance for chronic arthritis. Whoa. eye gouging. I've never seen an injury like that. I've seen people get poked in the eye. I've seen different types of things that cut the eye and traumas, but not somebody else's finger. That's gotta be really painful. And then obviously ripping somebody's skull apart, not really gonna happen. We have all those like suture lines. You've seen skulls where they have all like the zigzags because our skulls grow as we get bigger and then they stop. And then those suture lines actually fuse together. Whoa! Get out of that situation. Do you bring the legs with you? Yes. Because if it is actually a quite clean injury, there is replantation teams basically where they can actually try to use your tissue to replant the limb back on. I've had traumas where people left it on scene and never brought it. And if you don't have it, you can't reattach it. Okay, so this massive eyeball just being pulled out. What? So our eye has lots of attachment that keep it in. You got 6 muscles, top, bottom, left, right. And then you got some crazy obliques that do this nice movements for us. And then you have the optic nerve with the blood vessels hitting in the back there. Some people have like bulging eyes that are coming forward. And a lot of times we see that in hyperthyroidism. One of the ways we actually test for it is we'll actually look from over somebody's head to see if their eyes are coming further out from the bridge. There's that humerus. Super cool. Actually see the blood in the middle of the bone, so the bone marrow. And there's really cool mesh work of the bone and the structure of the bone where the blood flows through. And I bring this up because we can actually drill a needle. We call them IOs or interosseous, where we can actually put fluids and meds through that. Whoa, okay, so compressive force pushing the neck. We see so many vertebral compression fractures. Now, do we see them like this? No. But we see them when people fall. We see them when people get older and they become more osteoporotic, meaning their bones are a little bit more brittle. Simple things can actually cause their vertebral body to collapse. Oh, whoa, whoa, whoa. Good direct hit to the chest, puncturing the heart, puncturing the lung. If you have a direct blunt trauma to the heart, it's actually still survivable. That's why we do different major invasive emergent procedures at the hospital. A thoracotomy, where we literally crack the chest open, get to the heart itself, and see if there's a hole or a puncture wound that you can actually fix by staples, sutures, anything like that. Just get it to stop. Okay, just massive trauma to the skull, causing the brain to be just destroyed and crushed and brain matter everywhere. So we see people who get skull fractures. You can get a skull fracture from like very minor trauma, but most of the time it has to be a significant amount of force onto like a hard object. When we see people who have intracranial bleeding and subdurals, a lot of times we actually don't see skull fractures. I would say more often than not with head trauma, I see brain bleeding versus a skull fracture when it's that bad. What? So you can see a bunch of intestines on that one. And they're all different like spots instead of just like the classic string of intestines that we see. It was actually just like bundled up in there and then sliced. So they did a good job. Whoa. Wow. Bilateral lower extremity amputation. AKA his legs got chopped off. If I say AKA, to me, that also says above the knee amputation. And then we say BKAs, below the knee amputations. So it's very funny the terms that we actually use in medicine. Oh! Oh man, hit right in the front, messes with your trachea, could have your esophagus right next to it. Only very small blood vessels that are on the front. We'll do a procedure called a crike, basically where we'll actually cut this open to put a tube in the neck in an emergency situation. And it bleeds, but it's not as if you were cutting the sides of the neck where you have your major blood vessels on either side. The major blood vessels are protected by your skin, multiple different layers of muscle, but they are open to getting injured. Here we go. Oh, you get hit? Okay. What? Shot in the back of the head through potentially the helmet. We wear these big helmets. They are not bulletproof. They are potentially bullet resistant. If that person could get to a medical facility and their family or the patient wanted to be an organ donor, that is a prime example of good organs that can be used for somebody else's life.
Brian, let me see my girl.
What? A device rigged up with wires. We know what that is. Oh my gosh. Cut the red.
Wait, what are you doing? No, no.
Wow. In instances where somebody has an explosion that happens near them, they're getting compressive forces. There's a chance you can have what's called a pneumothorax, where air is actually forming outside the lung.
Yeah.
Oh man! Super worried about injuries to your ACL, your medial collateral ligament, and your medial meniscus. That's why we call it the terrible triad. There's 3 parts that get injured.
There's a magic number.
It all just has to do with the mechanism of the angle and it popping open. This is actually seen a lot in football injuries. When somebody gets hit and falls in a weird particular way, you see those type of injuries. Oh, okay.
Interesting.
Knife wound to the neck itself. This area we consider zone 2, which is the most dangerous area because you have all your vital structures. Jugular vein that sits on top. It's a slower bleeding vessel, but it's very large versus the carotid artery, which is deeper but smaller. Pretty much a shoot off of your major blood vessel, so it's pumping really hard. So you're gonna lose blood pretty quickly. Oh, blunt head trauma, skull fracture, intracranial bleed. You're thinking a subdural bleed, unlikely a subarachnoid, unlikely an epidural in that area where you're getting hit in the posterior part of the head. We see these all the time when people get brain bleeds in their subdurals. Most likely in the civilian world, car accidents cause these things, but most of the time it's falls. Helicopter. Get out of there! If I was in a helicopter and started doing this like crazy spin, I would puke my brains out. People get nauseous and potentially puke with roller coaster rides or spinning because your 5 senses are off. So your body gets this nauseous feeling. Whoa, super cool. Not a fun ride down. I always tell people when they fall, tuck and roll. A lot of people will reach out with their arms and snap a wrist, break a forearm. The parkour individuals that jump around and they don't seem to hurt themselves, they're doing lots of tumbling when they land. Parkour! Whoa, knife embedded right in the posterior left side of the neck. It's in the back, there's a lot of muscle tissue there. The major blood vessel is actually here in the neck versus getting stabbed just behind it. So that's why this individual is, one, not bleeding out and they're able to function. Obviously adrenaline, it's just a puncture wound, stab wound directly into muscle tissue.
'Tis but a scratch.
Oh, that's gonna potentially do one of 4 things that I can think of. Cause a pneumothorax. Then you can actually get blood that forms in that same cavity and causes a hemothorax. It actually can stab one of the ventricles of the heart itself. If it's low enough, it actually might hit the spleen and you can have a splenic laceration and splenic injuries. Multiple different things that can happen, just depends on the specific location, obviously where the knife goes in, but in that area, that's what you were thinking. That is a situation I would not want to be in. Oh my gosh. The injuries that you would see from this type of car accidents are random. You're getting a CT head, CT neck, CT chest, abdomen, pelvis, any x-rays of any limbs. You'll also get a chest x-ray and a pelvic x-ray right away because those are super fast images that really help a lot. If somebody has a bad pelvic fracture or something called an open book fracture of the pelvis, there could be a lot of bleeding in there and you want to temporize that immediately before sending them to another part of the emergency department.
Her life is in your hands now, Farah. Stay awake, she lives. Pass out, she dies.
What? Somebody passes out. We use a term called syncope. Typically it has to do with blood getting to your brain. It could be from blood volume, could be from dehydration.
I'll make it stop for
Not that way, Farah.
We see people who have near drowning. Sometimes you can have a dry drowning, basically water in the lungs or spasming related to swallowing of water into the lungs. Oh, explosive injuries with a fall and debris. Oh my gosh. Your vestibular apparatus in your ear is going to get all jacked up because of the compressive forces, puncturing your lungs, injuries to the chest causing hemopneumothoraxes, any fractures that can occur, anything that could be impaled into your body. Plus now you're falling through the floor, you're having all these other debris fall on you, causing more injuries. That's why you see people getting up slow. They're also getting up slow because their brain's concussed and they just don't know where they are. Come on. Good job, Captain.
Goodbye, Captain Price.
Anytime in anything we've ever seen, video games, movies, where the villain just starts talking too much, probably don't get it done.
You got me monologuing.
Yep, too much time. Wow, they're wearing a vest, but up here you may not have any protection other than the straps. You have your lung tissue in this area. There's major branches off your aorta of blood vessels right underneath your clavicle there, so that can get injured and have a lot of bleeding, could die pretty quick. Typically, if you're just getting hit up in that area and it's not hitting your heart, you might be down because of pain or shock from the emotional standpoint, not from a physiological standpoint. Wrapping a rope around this guy's neck is going to decrease the blood flow in and out of the head. Typically, the compression of the trachea isn't as much. You're getting more decreased blood flow to the brain itself. As you saw, it took a little while for the individual to become kind of lethargic and out of it, which makes sense. Oh my gosh! Breaking the glass and then causing the abrupt snap from the fall. Two ways of dying the snap, which will cause something called the hangman's fracture. Significant torque to the head itself. Super injured, will stop you from breathing, basically. If that doesn't do it,
His neck did not break.
now you have all that weight compressing down on all those major blood vessels and you'll eventually pass out and then succumb to the injuries.